7:33 now on this Thursday morning. It's been a hazy week across Wisconsin, and we're going to learn a bit more about that. We'll talk about some of the health aspects of it. It makes sense because it's time for our hometown health segment, and Dr. Kristen Lyerly is back here with us. Kristen, thanks again for setting up what we're going to learn today. Now we could talk about the different types of experts that are involved with this hazy air. I know that you don't know any Canadian firefighters, so we're not going to talk about the fires in
Oh,
Canada.
do you know that?
I have a hunch, but we'll save that for next week. But from a public health standpoint, you have found just the right person to visit with us today.
Absolutely. So we've all been experiencing, not just for the last couple of days, but this is the second time that this has happened to us across the country, really, where this hazy air, this air that's hard to breathe, and it's causing discomfort, it's disrupting our lives. This is very present, but what does it mean to us, and how does this actually impact our health? Not just now when we can see it and feel it, but are there other times in our lives where bad air is causing us a problem and we don't really know? So to discuss this actually very complicated issue, we have invited a wonderful treasure here in Wisconsin, Dr. Amy Kalkbrenner, who is an associate professor of environmental health sciences at UW-Milwaukee. Amy, welcome.
Thank you so much, Kristen. It's a pleasure to be here.
Thank you.
Sorry, the circumstances are better, but
the circumstances are terrible. So tell us about you and how you became an expert in this field.
oh wow. I'm an environmental epidemiologist. That's a mouthful, although I think that my dad was happy to tell me that now he feels like people understand more what an epidemiologist does because of COVID. But what I study is not COVID. I study environmental chemical pollutants, especially air pollutants, and how they are impacting our health.
And this is something you were doing far before we started experiencing haze in Wisconsin. So what are some of the typical pollutants that affect our health every single day?
Boy, that's an excellent question. And one of the things I always realize is that air pollution most of the time is invisible. We're lucky about that. Now, the last couple of days, it's more visible, but most of the time it's invisible. And so it tends to be something that we don't think about, just like we don't think about the fact that we're breathing it in and out all day long. But in terms of air pollutants that you, the listener, may have heard of, there are things like particulate matter, sometimes called PM, that's very important in terms of health. And in fact, that's one of the ones that we know is very high right now with the wildfires. There are things like ozone. There are nitrogen dioxides. We also have really a whole suite of metals in the air. You may know that, we can get mercury from the air, even lead from the air. And there are things called volatile organic compounds. There are actually hundreds or thousands of them.
Wow.
Yeah.
So all of this stuff is typically in the air, but now is a particularly horrible time for many of us. How do we know what we're breathing? Is there a way for us to assess, like you mentioned earlier, often we don't recognize because we can't see the haze. How do we know how healthy the air that we're breathing actually is?
Gosh, I guess that there are ways to know. And I'll certainly tell you about that. One of the ways that I have been finding out is by using my phone. A weather app these days usually has something called an air quality index, or an AQI. So this is designed to be a communication tool. And to me, this is one of the easiest ways. For anyone who's interested in learning a little bit more, usually a Google search of, like air quality or wildfire smoke will pull up a website of the EPA, the Environmental Protection Agency. And that's some of the best, most reputable data if somebody really wanted to look at the maps of what was happening. And we're fortunate that, this data is just becoming more and more available. And I also hope to think that as scientists, we're doing a better job of communicating these kind of things. I can't help but add, though, that it's difficult to think that we're in a situation where every person needs to become an expert on air pollution, or that, we would even need to be monitoring our air quality every day. And I always come back to, when we're looking at a problem like air pollution, it's something that requires a collective solution or a societal solution. And I can say more about that if you think that.
Oh, we'll definitely get into that. I want to stick with the AQI just long enough to take note of the morbid sense of humor some folks have had to bring to this. I've noticed readings the other day, like, well, Brookfield is at 194. Oh yeah, well, South Milwaukee is at 210. That's not the kind of competition that you want. But when you see it up again, the number lets you compare. That's the thing, apples and apples. So when you see what the AQI is in Dubai, or Calcutta or something like that, and you say, okay, this really is bad. But to come back to your point about, how much of it is invisible. And I know I've mentioned this before, but since the Clean Air Act, some of us are still old enough to remember actual smog and, the air pollution that you could see every day.
Yeah.
There are people now who think that because it's so much less visible than it used to be, that the air must be clean. But in your line of work, you're noting that it's still there, just not as blatantly visible as it was. And there is still a need to take actions that will reduce the amount of those pollutants, right?
You're right. And unfortunately, you're putting me in the seat of having to be the bad news guy here.
That's
But
okay. That's why we
even the clean air that we typically have in Wisconsin, and I'm going to give a little air quotes there to clean. It is cleaner than it was a few decades ago before the Clean Air Act. It is substantially cleaner than other parts of the world that don't have the regulatory protections that we have. Listener, you may have images in your mind of cities in India or in China that really have, daily struggles with air quality. So it is cleaner, but you're right that even within those levels that we're considered clean and that are invisible, unfortunately, we can still find that there are health effects even of those levels.
So can we talk about the actual health effects then? Because again, if somebody does not have respiratory issues, it doesn't take much to see people that are kind of poo-pooing this. And so I'd like from an actual health standpoint to know, when somebody has a respiratory ailment or when somebody is vulnerable, what is it that these particulates from the smoke or anything else, what do they actually do to the body?
Yeah. So if we can imagine, these teeny tiny things entering into our lungs, strangely, they also have a direct route to our brain through something called our olfactory bulb. And they don't just stay in the lungs. The lungs, they do their jobs and they clean out some of these, but some of them are so tiny that they're penetrating very deeply into the lungs. These are the tiniest particulates, sometimes called PM 2.5. And some of the actual chemical constituents of those tiny little particles actually go into our circulatory system. So maybe it's a metal, maybe it's something else that's actually stuck there on that tiny particle. The other thing that happens, though, is equally important, which is that our body mounts a response. So our body's trying to do its job. It mounts something called an inflammatory response. You may know this is something that, around a cut on your finger, it makes it a little bit red, but you can get an inflammatory response throughout your whole body. And this is not good news. And it really impacts health throughout your entire body. So a key point about air pollution is it's really not just impacting the health of your lungs. We know for sure, for example, that it's impacting heart health, cardiovascular health. It's impacting brain health. It can affect development. And these are more of the long-term health effects of chronic exposure.
So if I'm not feeling burning in my throat and my nose, if I'm not actually having a hard time breathing, it's still affecting me.
It could be. It could be. And, at some very small level, impacting all of us.
Mm-hmm.
I am a public health professional, and so I'm very much trained to think about this community perspective. And if I could just say a bit about that, what it means is that it might have a very small effect on me as an individual, or you, or to you, Pat. But when you have, a whole town, or you have a whole state of Wisconsin, those small impacts can add up. Everyone is shifted just a little bit, and it really matters. The other thing to keep in mind is that some people are more susceptible than others.
Let's talk about those people, because they're people that you and I care deeply about. They're some of the most vulnerable people in our population, pregnant moms and young kiddos. This is an area of special concern for you. Tell us a little bit about how this bad air is affecting young kids.
I will. And of course, it's not limited just to those age groups, but, Kristen, you're an obstetrician. And this is what I study. I study exposure during pregnancy and for infants and toddlers. And we know that it is changing their development. For example, it could lead to a baby being born early, preterm birth. It could lead to difficulties actually with behavior. Personally, I studied links between air pollutants and autism. And that might sound really surprising, but consistently, study after study is showing that it can increase the chance of having an autism diagnosis to be exposed to air pollution.
That is so hard to put together for those of us who don't understand it at that level, because we think about, it's bad air, we're breathing it, but to connect it with autism, Amy, that's incredible.
I agree. And it might sound scary. And I think that oftentimes when people get scared, when I get scared, and when I hear about all of this, it's really easy to tune out. One of the things that I like to remember is I come back to the clean air itself. As a society, we did this amazing thing. We passed the Clean Air Act. We dramatically improved our air. And I like to think that we're not done. Collective action can seem really nebulous, and it can seem like, well, what can I do as an individual? But in actuality, we can do things. We can, work together, pay attention to what's happening here. And of course, we know these wildfires are really being influenced by climate change. Again, a big topic, a scary topic. But I think that society is becoming more aware of the fact that climate change is now, and that we can ask, our officials, we can speak up to the Environmental Protection Agency. We are very fortunate in Wisconsin to have something called Healthy Climate Wisconsin. It's this physician-led organization that is specifically trying to get us connected, to get us to know what is the EPA considering. I know that people are also so interested in, but what can I do now? Okay, yes, it would be really great to slow climate change, but what can I do today? And, one of the best things you can do actually is pull that mask out of the drawer that you got really tired of looking at during COVID.
Oh, yeah.
Especially if it's that KN95 or that N95. We know that stops the particulates from just entering your body. If you stop the exposure, you stop the response.
That's excellent advice. And again, a reminder that by having somebody who is in this from a health and medicine standpoint, that these aren't just, empty words out there about climate change. This is about what it actually does to the human body. And it's for that reason, Amy Kalkbrenner, that we are so thankful that you could join us today to talk about that. I hope that you will allow us to check in with you again to talk more about this very important topic.
Thank you, Pat. Thank you so much, Kristen.
It's been a pleasure.